why did you decide to host T-level students?
I'm going to be honest, we were a little bit reluctant at first, but actually we were quite surprised how well it actually went. We were worried that it was going to be a very fast, busy clinical environment, and we wanted to make sure that our T-levels could be supported. And in actual fact, they worked with some of our HCAs, and the HCAs did a brilliant job of looking after them. Both of them had a great time and learnt loads, and actually learnt things about what they were what they wanted to do as well. Actually gave them some options. One of them decided that they didn't like, they were given some time in our cath lab, which was like working in a theatre, and actually she preferred to be on the ward. So it was actually really helpful for them to find out what they were good at and what they liked doing in healthcare as well.
How have T-level students benefited the ward?
Because we learnt that actually we can look after T-level students. It benefits the ward significantly, because maybe one day one of those T-levels had enjoyed themselves so much that they may choose to come back and have a job with us, which would be amazing and fantastic. So we're always on the lookout and scouting for people who may want to join us in cardiology. And it also taught us as well that we can look after that level of students, and that they're mature enough as well, if we choose the right T-level student to come and join us, to be part of our team for that time.
How have the students developed since they started placements?
So it helps them sort of decide what they want to do in healthcare, and that was you could see that when they first started. They came, yes, did they want to be a nurse, did they want to not be a nurse, but by the time they left they had a clearer idea of what they wanted to do, which was lovely to see. They also learnt the ward routine, and they grew in confidence as well with their communication skills and talking to the patients. They learnt, just by watching, that they can do that and go and sit and chat to a patient and find out about them as well.